My name's Melissa.
And I'm Tracy.
And we're therapists in the Joint Replacement Center of Excellence. In preparation for your surgery, we'd like to show you some exercises. We'd like you to start now.
Strengthening your muscles as best you can before surgery will help you recover faster.
We will start with exercises to help strengthen your arms prior to surgery. You will be using your arms after surgery more than you may be using them now. So we've chosen certain exercises to target certain muscles. The first arm exercise is a seated push-up. To complete a seated push-up, you will need to identify a stationary chair that has armrests. Sit with your bottom close to the edge of the chair, with your feet out in front of your knees. Place your hands on the armrests. Slowly raise your bottom up off of the chair by pushing with your arms, like you are going to stand up. Then lower yourself back down until your bottom is resting on the chair. This movement should be slow and controlled, and you should pause briefly on the chair in between each lift. The goal is to perform 10 repetitions 3 times a day. If you do not have a stationary chair at home, or you have a shoulder injury or any pain while doing this motion, we'd like to recommend a second exercise instead of doing the seated chair push-up. For the elbow extension exercise, you will need to identify something you can hold in your hand like a weight. If you have a dumbbell at home, that's great, but if not, you could hold on to a can of soup, beans, or a bottle of water. Lay down on your bed and hold the weight in one hand. Raise your arm up towards the ceiling and use your other hand to support your elbow. Slowly bend and straighten your elbow. Once you have completed 10 repetitions, switch the weight to the other hand and repeat. Try to hold enough weight in your hand that by the time you have completed 10, your arm is tired. If laying down is not comfortable for you, the same exercise may be done in a sitting position. Just be sure to keep your elbow pointed straight up towards the ceiling while you are bending and straightening your arm. The goal is to complete 10 repetitions on each arm 3 times a day. Next, we will show you some leg exercises. These leg exercises should be done on a bed or elevated surface. The goal is to perform 10 repetitions of each exercise 3 times a day. Let's start with ankle pumps. To complete ankle pumps, you will point your toes as far as they will go and then pull your toes back until you feel a nice stretch in the back of your lower leg. This should be done at a slow and consistent pace. Remember, 10 repetitions 3 times a day. Another leg exercise strengthens your quads. Your quads are the large muscle group on the top of your thigh. To complete quad sets, tighten the muscles of your thigh and push your knee down towards the bed. Hold for a count of 5 and then relax. Do both legs together and be sure to keep breathing in and out while you are exercising. Your next exercise is a gluteal set. To complete this exercise, tighten your buttock muscles, hold for a count of 5 seconds, and relax. Heel slides are performed one leg at a time. Slowly slide your heel up towards your buttock as far as you can comfortably. Try to keep your heel in contact with the bed. Your movement should be done at a slow and consistent pace. Once you have completed 10, switch to the other leg and repeat. If you are having a hip surgery, your next exercise is hip abduction. When doing this exercise, keep your knees and toes pointed up towards the ceiling. Slowly, slide your leg out to the side as far as you can comfortably, and then back to the center. Keep your leg supported on the bed while sliding your leg. Do not lift it up off of the bed. Some patients report that this exercise is more comfortable in a standing position. Just be sure to hold onto a counter or railing for support. If you are having knee surgery, your next exercise is a straight leg raise. This is also performed one leg at a time. Bend up one leg in the bed to help support your low back. Keep your knee straight on the leg you are going to lift. Raise it up off of the bed, no higher than the level of the opposite knee. Pause, and then lower your leg back down to the bed and relax. Movement should be slow and controlled. Once you have completed 10, switch to your other leg and repeat. Remember, with the exception of the propped knee extension exercise, these exercises are to help you prepare for surgery. Do what you can, and if you have any questions about these exercises, please discuss with your surgeon.